My name is Krause, and I will be using my phone to swipe through the slides. I picked my topic, Pseudomonas aeruginosa infection. Now, what is it? It is specifically a bacteria, and even more specifically, it is a Pseudomonas bacteria, and Pseudomonas is the genus name. And it causes disease and infection. It is specifically a gram-negative, aerobic, non-spore-forming rod. This bacteria is mostly opportunistic, which means it takes advantage of people who are sick, who have things like cancer, HIV, and things like that, or people who have a suppressed immune system. It causes infection in many different parts of the body, your stomach, your heart, your lungs, and many other areas. Cultures and isolation. The bacteria can grow on an agar plate. The specific bacteria grows best at 37 degrees Celsius. It usually takes about 16 to 14 hours to grow, but sometimes a couple of days depending on the materials used. It grows faster though on a rich medium. Pseudomonas aeruginosa can also be isolated by using the enrichment procedure, which enhances the population of a specific group of microorganisms. The selective and differential media method can also work for this bacteria as well. And that is a close-up picture of it on a plate. Where it can be found, how it can be transmitted, and who is most at risk. Now, this bacteria is mostly found in the soil and water, but it can also be found in healthcare settings, food, skin, and medical equipment. Now, transmission, it can be passed on to people through pools, hot tubs, sinks, hands, ventilators, catheters, bathtubs, and surfaces. This bacteria grows best in moist environments, so that's why it is found in places like pools and hot tubs and sinks and ventilators, because a ventilator is hooked up to somebody's mouth and the saliva creates a moist environment as well. People at risk include burn patients, cancer patients, people with HIV, AIDS, anyone with a suppressed immune system, basically. Any hospital patient, because it is mostly found in the healthcare setting. Pregnant women, people healing from people healing from surgery, mostly from transplants. Now, these pictures are examples of certain types of things you can find in the hospital that it can be transmission. People can transfer it through these devices in the hospital. This is a Foley catheter, and when Pseudomonas aeruginosa causes an infection with this, it can cause things like a UTI. This is a type of catheter as well, but this one can pass infection through the bloodstream. This is a type of ventilator, kind of like a BiPAP and things like that. People who wear one of those can be at risk of getting the infection. How does this bacteria cause disease and its symptoms? This bacteria mostly causes problems by infecting people who already have a health issue, like COPD, cancer, lung cancer, and things like that. It also can affect normal, healthy people, but it is mostly seen in people who already have an issue with their health. The symptoms can come from the body trying to fight off the infection. Things like fever and sweats and stuff like that can be from your body trying to fight off the infection. Infections from this bacteria can also make symptoms that people are already experiencing from another health problem worse. For example, burns. If a burn patient gets an infection with Pseudomonas aeruginosa, then that burn is going to get worse and it's going to take longer to heal, and which causes more pain in the end. And then the different types of infections that this bacteria can cause is hot tub folliculitis, otitis externa, UTI, meningitis, and endocarditis. I'm going to be talking about a few of these. Pneumonia. Now, this isn't seen as much as the other type of infections, but pneumonia can be caused by this bacteria, and it is usually acquired in the hospital. This problem can happen to people who are on a ventilator, have recently used a bronchoscope, or have a chronic lung disease like COPD. And it can be found in this ICU because people in the ICU are usually on a ventilator or having something to help them breathe. And treatment can include aztreonam, carbapenems, ceftazidime, ciprofloxacin, and gentamicin. And these two pictures are examples of ways you can get pneumonia caused by this bacteria. This is a ventilator that you can find in the ICU, and this is a picture of a doctor putting a bronchoscope in somebody. It's basically like a little camera used to see inside of you in the area. Folliculitis. Folliculitis, more specifically hot tub folliculitis, is what this bacteria causes. It affects the skin, as you can see here. Specifically, it is infection of the hair follicles on your skin. The bacteria can be found in hot tubs and pools, which is where people get this certain infection, which is why it is called hot tub folliculitis. It causes these red and itchy bumps all over your skin or any affected area. Like when you get in a hot tub and pool, your whole body is submerged, so it will affect most of your body. And the treatment for this is it usually clears up on its own, but in certain circumstances it won't, and doctors will prescribe an antibiotic. Otitis externa. Externa is an infection of the ear caused by Pseudomonas. Yes, this infection is also known as swimmer's ear. I'm sure we have all heard of this, especially when we were little, when we would go to the pool with our parents. It can cause infection of the external auditory canal. If left untreated, this is very important, it can cause more serious problems like malignant external otitis, which can spread to other parts of the body and cause more infection. Otitis externa can also come from swimming pools and hot tubs, just like folliculitis. Treatment of this includes polymyxin B, neomycin, and hydrocortisone. How does this bacteria affect burn patients? When you think of Pseudomonas aeruginosa, it is easy to think of burn patients because this bacteria mostly happens in burn patients or associated with burn patients. It is one of the most dangerous types of bacteria that can cause infection in burn wounds. It can make recovery last longer because it makes the wound even worse and the pain worse. And an infection can lead to sepsis and can even cause death. So if you don't treat the infection from the bacteria soon, then it can cause sepsis. Burns are a good place for this bacteria to thrive in because of the moist area of the skin. Treatment that you can use for an infection with burns is aztreonam, carbapenems, ceftazidime, ciprofloxacin, and gentamicin. Signs and symptoms. Now, the symptoms are going to depend on what part of the body that this bacteria affects. In the blood, you might see chills, fever, joint pain, hypotension, and muscle pain. Like sepsis, you might experience those symptoms. And in your ear, we just talked about otitis externa, you might have an ache, you might have fluid in your ear, itchiness, swelling, and a little bit of loss of hearing. Now, in the GI tract, you might have a headache, nausea, and vomiting, and diarrhea. And in your eye, I'm sure we've all experienced an eye infection, but in your eye, with this bacteria, if it gets infected, you can have inflammation, pain around the area, pus, redness, swelling, and vision loss. More signs and symptoms include chills, cough, difficulty breathing, and fever of the lungs. So if this bacteria causes pneumonia, you might experience some of those symptoms right there. Skin, we saw this in folliculitis. You can have discoloration with bumps, a clear pink fluid that smells and drain, or a fluid that's drained from a wound. You can see that in burn patients. Itching, white yellow pus, field bumps as well. In the urinary tract, which can be from a UTI caused by this bacteria, you might have sudden uncontrollable pee, urinary incontinence, pelvic pain, pain during urination, and frequent urination. Now, diagnosis. This is tricky because the symptoms from this bacteria can be anything, but to start off, the doctors will always start by listening to a patient and ask them questions about their history and where they've been and what past medical issues they've had before, and they will ask them about their symptoms. A physical exam might be done by the doctor, and that can include listening to your heart and lungs, examining your skin, examining your eyes, examining inside your mouth, and they also might feel your abdomen. And the one of the most important questions when looking for an infection is, does the patient, whether or not the patient has a weakened immune system? Because if they see that patient is a burn patient, then they should automatically think, oh, I need to test them for this bacteria. To diagnose a patient, a sample of blood or bodily fluid, depending on what is infected, will be taken depending on what body part is infected. The blood or body fluid will be sent to the lab for testing. Treatment. It is becoming more difficult to treat because this bacteria has become more resistant to antibiotics over time, and it can even become resistant to multiple antibiotics at once, which is why getting this infection can be dangerous. And it's important to treat it early, but treating an infection with this bacteria early is hard because it can be hard to find the antibiotic that will work. To find out what antibiotic works best, a culture might be sent to the lab for testing to see which antibiotic will work against the bacteria. Treatment also depends on the type of infection that they have. Some more antibiotics, other than the ones I mentioned earlier, more antibiotics that could treat Pseudomonas aeruginosa can include aztreonam, carbapenems, ceftazidime, ciprofloxacin, gentamicin, and ticagrelin. Prevention. Prevention can actually be really easy. Prevention can be washing your hands. As simple as that, washing your hands before and after caring for wounds or touching medical equipment. And it's also important to remind the people around you to be safe and wash their hands, not just you. Be careful of what you touch. If you know that a patient is infected, just wear gloves and be safe. And it's also important to make sure hospital rooms get cleaned properly, because we don't want to put a patient in a room that's infected and then they get infected, and then so on and so on. Create water management plans. Every hospital and every place that can have infections needs to make sure that the water throughout the building is safe. And it is also important to use disinfectant wipes on surfaces, so if you don't have access to a lot of cleaning supplies, or you don't have access to direct soap and stuff, things like that, disinfectant wipes can work as well. Do not share personal belongings with other people. That is a very important part, because you don't know who has what, and this bacteria can easily be transferred from one person to another. And finally, this goes for burn victims and the people who are taking care of burn victims. Cover and take care of any type of wound. Now, this picture explains a specific way to wash your hands, and a good way to wash your hands. First, you need to rinse your hands first, then put the soap on there, scrub for a while, for a long time, and make sure you get every area of your hand, fingertips, in between and all, and then you dry. And that is all. Thank you for listening.